All right. Thanks everyone for joining us. Hopefully we'll have a few more folks I think who are coming in, but we want to get started. We know that your time is precious and also know this is holiday season. So I want to respect your time and get into this great conversation. Thank you to Jim being willing to come. And Jim's been actually supporting the task force, a great supporter in many ways through the years. And so we just really appreciate the way in which you're always caring and letting us know about things that are happening that we should be mindful of, and always inviting us to the table has always been something we appreciated from the Patient Coalition. And I'm going to really hand this over to you to get started. Yeah, a few announcements would just be really the task force is taking a break for the rest of the year. And so you will not hear from us, see us, do anything with us until the new year, because it's important that volunteers and staff take a break. So this is our last event of the year, but we do wish everyone, happy holidays and also hope to see some in January 10th at our New Year's party, which will be at Odessa Brown. Super excited about that. But yeah, outside of that, no other announcements right now. I'm going to just hand this on over to Jim.
Hmm. Great. Thanks, Foxy. So glad to be here. And excuse me, just as you hand it off to me, I got a little frog in my throat. But anyways, I'll introduce myself real quick while I try and catch my breath. Um, let's do this to make it easier. Okay, so Jim Freeberg, I am the executive director of the Patient Coalition of Washington, which I'll talk about shortly. But I'm going to talk about healthcare policy from a very big picture. I'm glad we've got a small group and we can have plenty of conversation. And my slides are at a very high level, not meant to be comprehensive by any means, but at least kind of a starting place for people that are interested in this whole idea of policy, but don't even know where to start. So, with that, if you got questions, jump in and happy to answer them live. If you want to hold until the end, that's fine, especially if you think it's going to be kind of a larger discussion. So, I will figure out how to advance the slides here. So, um, what we're going to talk about today, we got kind of four topics. One is, how politicians oversee our healthcare system. And on a basic level, you got state government, you got federal government, you got local governments. We're going to talk about that, kind of who's in charge of what and how these policies impact your life, specifically, obviously, from the healthcare angle. That's what we're talking about. And I want to talk a little bit about how to stay informed about changes in healthcare laws, because this is the hardest one, I think, is to get up to date, current, accurate information in this day and age. So we'll talk about that a little bit. And then at the very end, we'll talk about how to be an advocate for yourself and your community, which I'm hoping we can get folks to do. So let's jump in. First off, the Patient Coalition is an advocacy coalition with a mission of advocating for people with chronic or rare diseases. Um, and our focus really is on these five topics: access to high quality care, affordability, awareness, health equity, prevention, and early detection. So with that, those are kind of these big buckets and big themes that we think about all the time as we're working with state policymakers. And it really varies kind of from year to year and bill to bill how these different values play out and kind of show up in our work. And we'll talk about that a little bit more and give you some more examples of that. One key thing that about us is we do not do advocacy for individuals. While we are an advocacy organization, it's a systemic level. It's not something where we're going to go to bat for people um, with questions about their own health coverage. More than happy to point people in the right direction and provide some general resources, but that's not something that we do. So our membership is made up of 18 different patient advocacy organizations. You see the sickle cell task force up there. Um, and membership is limited to just patient organizations. So we don't have healthcare providers at our table. We don't have the insurance industry. We don't have the pharmaceutical industry. All those other groups have lobbyists, working for them. They got plenty of lobbyists. The idea is here is to make sure that patients have a lobbyist that reports directly to patients, not any other part of the healthcare system, because we know there's just different perspectives on issues. Sometimes we're aligned with the physicians and the doctors and the hospitals. Sometimes we're not. And it's really important for us to make sure that we're independent and we're not getting money from anybody that's going to want us to have a certain position. So it's just these patient groups here. A couple ways to think about kind of why we exist, and then even if you're talking to people about this organization, how to talk about it. I think that our work is really to break down systemic barriers. We work with policymakers just at the state level. We do not do work at the federal level um, to find solutions that are going to make our healthcare system a little better. This is kind of slow, hard work. I wish we could have bigger changes faster. That's not how our democratic process is designed. And we are but one small player in a very large pond down in Olympia. So, for a little bit more information, you can look at our website, Patient Coalition wa.org, and it talks about kind of our values that you saw there before and our membership. So, okay, so going into the heart of this, just from a very high level, think about our healthcare system. I think about it kind of has three main buckets that everything falls into. You got providers and the delivery system, doctors, prescription drugs, hospitals. That's one aspect. Second aspect is money. How do things get paid for? Who pays for them? What they're going to cover? Who gets those benefits? Who doesn't? And of course, all these things are governed by laws, right? And that's really this policy piece is governing and talking about how we spend our money, who gets it, and quite often, right, who doesn't get it. So if we're thinking about policy, it really is this big picture bucket of these three different pieces of the healthcare system, um, but with the focus on those laws here. So, um, a quick primer on kind of who does what, who's in charge of what. Obviously, our healthcare system is largely this partnership between the federal government, with Congress and the president at the helm, and state governments with the governor and the legislature there making the rules. This is not a comprehensive list of who's in charge, and there's a lot of overlap here. For example, Medicaid is a state federal partnership. So both Congress and the state legislature have the ability to make changes and deliver those services to put folks on Apple Health. However, the federal government, kind of the law of the land, the state has to work within the parameters that the federal government lays out. Um, this is important too to talk about kind of the scope of what the patient coalition can work on. All the stuff on the left side of the screen, Medicare, TRICARE, that's dealt with in Washington, D.C., beyond the scope of what the patient coalition has the ability to work on. But everything on the right side of the screen is kind of within the ballpark of what we can work on. A big piece here that we're going to talk about Medicaid in Washington, we call it Apple Health, and then Obamacare, which is folks can get those plans on Washington Health Plan Finder, otherwise known as the exchange. So the Department of Health and the Office of the Insurance Commissioner are two. There's actually another agency that we work with quite a bit in Olympia called the Healthcare Authority that delivers and kind of oversees Apple Health. And we work regularly with each of these agencies in these different sectors of the healthcare industry. So at the local government, this is kind of a third piece here that we don't actually work on very much, but is a very important part of our healthcare delivery system, obviously. In Seattle, King County, you got Public Health District, Harborview, that's county owned, right, and managed by the University of Washington. And then there's other public hospitals, like Valley. I live in Renton. Valley is a really important part of our life down here. My mother-in-law has pretty significant health issues, lives with rheumatoid arthritis, and goes to the hospital kind of 2 or 3 times a year. So we're very familiar with Valley, really important part of our hospital system. In Kirkland, you've got Evergreen Health, and in other areas throughout the state, a number of different public hospital districts. So I'm going to talk about the federal budget in a big way here because this is the biggest changes to the healthcare system are coming as a result of the HR1, otherwise known as the One Big Beautiful Bill. This is the budget that was passed by the Trump administration this past summer, and there's some significant changes in here that will significantly reduce the number of people with coverage and weaken that coverage. So we're going to talk at a very high level. I will talk a little bit more kind of what exactly this stuff means for individuals. But in a big way, there'll be fewer coverage options for lawfully present immigrants. There's more bureaucracy and red tape, and by that, one of the big things that's coming in place is work requirements, where people on Medicaid, and there are some exceptions, we'll talk about those, some exceptions, will need to show that they work 80 hours a month, and work could be including volunteering, um, school, or paid employment. There are some exceptions for people with serious chronic health conditions that we'll talk about, exactly how that's defined, because that's obviously pretty important. There are some exceptions for parents of young kids. So if your children are 13 or younger, you'll be exempt from those work requirements. But in order to prove that you have to um, that you meet those requirements, that's a lot of just, unfortunately, it's bureaucracy to show that you're going to be able to get Apple Health. Another piece of this is there's requirements that you will have to reapply for coverage every 6 months, which is just kind of a disaster because as folks with sickle cell know, your disease, your condition doesn't go away. Nothing's going to change in 6 months. So, Ken, go ahead.
Well, I just had a question about number one. Lawfully present immigrants will lose coverage. We have a large population of immigrants that have sickle cell. So we really need to understand what the impact of that is going to be. Um, and so that we can convey that on to what the options are to that community.
For sure. I appreciate you sharing that, Ken. And I think, part of my hope with this discussion today is this is the start of a conversation, and I'm happy to dive in to this more for you guys to understand those options. One of the things that we're working with legislators right now is if they're going to lose access to some of these federally funded programs, what can the state stand up in its place to make sure that those people continue to have access? Because obviously it's critical, right? You got to have healthcare with a chronic condition like that. So let's put a pin in that and let's talk about that even at the end if there's time because that's yeah, very important. Um, Number three here, there will be fewer people, not just those lawfully present immigrants, but because of those work requirements and the fact that people have to reapply every 6 months, we just know there's going to be fewer people with coverage. In addition, there will be cost sharing requirements. So right now, if you're on Apple Health, you don't have to, have a copay when you see your doctor for most services. But under this new law, there are copays that will be required up to $35 per visit. There's some exceptions for primary care and a few other services, but we know that that's a barrier for some folks. So the fourth piece here is described as kind of a weakened safety net. The federal government and the state government contribute a lot to healthcare providers that serve um, underserved communities. And that's just kind of a general cash infusion. The HR1, One Big Beautiful Bill, limited how much the state can raise and in turn send back to providers that really need these funds just in order to keep their services afloat. No. And then lastly, there are fewer subsidies for people who buy Obamacare plans. And this is what's been in the news right now. This is what the government shutdown was over, where the Democrats had insisted that subsidies be continued for people that buy Obamacare plans. There's still discussion in Congress for Republicans joined with Democrats earlier this week to force a vote in the House that'll happen in January about extending these subsidies. Unfortunately, they do expire under current law at the end of this year. And so even if they vote in Congress to approve them in January, there's going to be some gap in lapse in coverage for folks that get, again, those subsidies. So based on income, a sliding scale. The significance of this here is that these people that have come to rely on subsidies are going to get hit not by the loss of subsidies, but also just massive healthcare inflation. We know prices have been rising year after year for everything in the healthcare system. And so insurance, the baseline insurance without the subsidies is increasing anywhere from 10 to 20% or more, depending on what plan you buy. And so there's really massive hits. And that's why some people are going to see their premiums double. Okay, so what exactly is changing when? Um, just mention that those subsidies are going to expire January 1 if Congress doesn't act. And even though a few of those Republicans join with Democrats, I think it's still pretty unlikely. That application process will kick in January 1. And again, there's only a subset of Apple Health enrollees that have to do this. But the feds are still working to put these rules together that tell states how this will actually happen. And so we don't exactly know with as much detail as we'd like who is going to have to reapply every 6 months. And then those work requirements won't kick in at the earliest a year from January. The state can apply for an extension, so that might get pushed back to 2028. Um, and that is just for able-bodied adults, which is not really defined very well in law. We're waiting for that federal guidance. Like I said, it's coming out perhaps this week or next that will give direction to states. That'll have a little bit of discretion as to how they define that. And so our lobbyist has already been working with the governor's office to make sure that that is a very broad definition that is easy to document, right? I mean, we know patients unfortunately have to go through way too much paperwork and bureaucracy to prove that they have a chronic condition that's going to prevent them from working. So our goal here is to minimize whatever that looks like. I wish I had more to share in terms of what's this really mean, but it's a work in progress that we just don't know right now. Um, there are a few bright spots. The gene therapy treatment that is unrolling through a number of states, including here, locally. And I know Foxy's and I have talked about this. That pilot project is still expected to continue, and there were some fears in Washington State that there wasn't going to be enough money to do that. I've been having some discussions with some of the staff in the governor's office, and it looks like that will continue. So it's not a threat at this point. There's still plenty of other hurdles to get that happening that I know Foxy's on top of. And then there will be some more funding available for rural healthcare. When the budget debate was happening, there was a lot of fear that rural hospitals were going to close down because fewer people in rural areas were going to have coverage. Those hospitals are already just hanging on by a thread because that aging, diminishing population is not there to support hospitals, especially when we know rural communities often are sicker, older, and poorer than urban centers. So that's just a challenge, even with this big bucket of funding that the state's applying for to prop up the rural healthcare system. I think there's still a lot of questions as to whether or not that's actually going to replace the loss of funding that we heard about earlier. So, as I kind of get to the closing here, one thing I think that's really important here is to advocate and speak out about this. And this is a challenge. I'm talking to people wherever I go, and I'm really curious, do you know about these cuts that are coming? Are you impacted by them personally? And if so, speak out, share your story. Share that with social media. Go one step further, call a reporter, ask them to share your story and share with lawmakers, especially in Olympia. They need to hear the stories of people that are impacted with these policies. And this last piece here is engage, and I hope this is what we can have a conversation about, is to figure out how we can collaborate and work together to elevate the voices of your community to see if we can get some improvements to the system that we just talked about. So,
I have a quick
sure.
question on some of that. So when we talk about lawmakers, people in Olympia, when you're writing letters and doing or calling or however we communicate and tell our stories, who are the people to do that to? The legislatures, Congress, who do you do who do we send that information to or tell our story to?
Yeah. Your own state legislator is the place to start there. And I was at a conference last week on a healthcare panel with the chair of the Senate Healthcare Committee. She's Senator Annette Cleveland from Vancouver. There was another Senator, Jesse Solomon from the Shoreline area. He was in the room. He's not on the Healthcare Committee, but he's interested in learning more about healthcare. And I think a lot of legislators that aren't familiar with healthcare want to know what's happening and are looking for people to kind of help them understand what the impacts are in their community. And so I say that because legislators, even if they're not on the healthcare committee, are still interested in hearing what's going on in their community. And I'll see if I can find a link, Peggy.
And
And
do you still think it's beneficial or to we've gone to Olympia before? Do you still think that's something that I mean I've done it a few times. So do you still think that that's something that's worthy of doing
absolutely, yep, yeah,
and
uh,
bringing our community members of the community to tell their story? Okay.
absolutely, yeah. Especially, every year there's literally hundreds, if not thousands, of bills that they are discussing. And
Hmm.
when you go to Olympia, you can get in front of them and give them an opportunity to hear your perspective on bills that are getting heard this year, right?
Hmm.
And that's really what the legislature is trying to figure out, is how to respond to the big budget cuts. So even if you were there, 2 years ago, it was a different environment, a different
Right. Right.
situation. They're taking different votes than they necessarily would be this year.
So when is the best time to do that? I mean, during the sessions, or I mean, when is the best time? Because it does take some coordinating for us to
Oh yeah,
do
yes,
that.
it sure does.
Hmm.
I would say, anytime. I mean, for a group like the task force, there's if you're like talking about a specific bill, there's certain times you want to be there to to influence that. And that
Hmm.
if you guys want to do that, I can help you and talk about the different bills that we're tracking as the Patient Coalition right now.
Hmm.
Most of what I've talked about, though, is happening in the budget, which it is a bill, but it's kind of a different process.
Hmm.
It doesn't have the kind of the bill number with the hearings in quite the same way. I mean, it does, but um, and so it's a short session. It's a 60-day session.
Hmm.
Um, that budget debate will be going on, until the last day of the session. I mean, it's usually one of the final bills that they vote on. And so, you know, if you go down, session this year starts January 12th. If you don't come down in the middle of February, that's great. If you can make it during January, that's great. Um, if you're not there till, you know, the last kind of final weeks in March, a lot more of that stuff is kind of baked, right? So you're going to have a
Hmm.
little less impact. But yeah,
Great, thank
yeah.
you. Well, since nobody's talking, I have another question. So when we went to I was looking at the first part of this when you put up the first thing, something was about employment. So this might not even be relatable, but I've talked to a few people this week actually, um, that there is the HIPAA not the HIPAA laws, but the FMLA laws, where we have people that we have a community that many of them want to work. Not only does it bring money in, but it also gives them a sense of purpose. It gives them something to do. It's a diversion from their disease. It's very meaningful in a lot of ways. And we have people that unfortunately can't make it. I don't know if it's a 6 months or a 12-month period with most employers that a person only has so many sick leave, so much sick leave without it becoming problematic and being terminated or asked to quit before they get terminated. And it's such it's just really I've just had some conversations with some people, not only about that, but just so much less compassion for people with these kind of diseases. So I'm just wondering, how do we look at that in the future and say, there are people that are going to get sick before this 6 or 12 month period. There are people that are going to have to go to the hospital, and it's legit, it's real, so how and it's so discouraging. I know of one person that was asked twice to quit their job or be laid off. It's a very, they're living with this disease and then they're getting rejected from employers for things. So what I mean, is there any way to kind of, I know this is all laws, I know this is all hard work to change, but the world is changing, and people are living longer with these diseases, and people need a chance to work, to give back to the community. So I don't know if this is totally off subject.
It's no, it's a great question. I wish I had a better answer for you. FMLA is its own kind of body of policy that we have not been really involved in. There's a large coalition there that I'm happy to refer you to, and I can put you in touch with somebody that kind of knows that world a little better.
Mhm.
But I mean, you're right in that like the world is different. And unfortunately, too often these programs are just too rigid to reflect the people's realities, right? Like that's
Mhm.
the kind of the sad part of a bureaucracy is that there's not as much discretion as you'd like it
Right.
to be. Um, so happy to kind of dive in more, and we could take that offline to kind of see what's possible. I just don't know that law that
Okay.
well, and
I'd
like
love to
yeah,
know a little bit more about that. Thank
yeah,
you.
yeah.
Jim, what are you seeing other disease-specific organizations are doing right now? If you're seeing anything in particular with the budget changes coming, are you seeing some really positive moves people are making? Are you seeing people, or is it just kind of a wait and see situation? Yeah, I just was wondering,
Yeah.
it feels like so big, so out
Mhm.
of our control. And so the best thing we can do is like bring you here, help us ourselves to be informed of what the changes are. But I don't know if there's an organization doing something around this that you're seeing.
Yeah, I mean, I would say the big national organizations have the capacity to kind of do things at scale. One of the reasons I started the Patient Coalition 5 years ago was that I felt like they kind of fixate so much on Washington, D.C. without realizing that there's this incredible opportunity in states and state capitals. Um, and so the large national groups have finally, I think, started to collaborate more and put together a letter. And I'll share this with you, Foxy, and you can share it with others that puts kind of some priorities in place. I don't know if there's a representative from the sickle cell community on this letter that I'm thinking about, but it at least I think if you look at it, it'll resonate in terms of there's probably pretty similar priorities from what you would kind of come up with yourself. So one thing that we are doing this year, I would say, like kind of as a patient community, is talking more about the budget to legislators. In the past, we haven't talked as much about budget. We've gone down and talked about specific bills. We've worked really hard on state-funded subsidies, and we'll continue to do that. That's a big thing that actually we're trying to do. And that's, kind of this middle income folks, people that make a little bit more than they would to qualify for Medicaid, but still don't make enough, on their own to pay for insurance without some help. And those subsidies, we just had a meeting yesterday with the Senate Ways and Means chair who had some ideas about how we pay for those because they're incredibly expensive with the federal subsidies going away. And I mentioned, right, the insurance is going up. Um, there's just gonna be more people that can't afford their premiums, right? So I would think that is kind of like but one issue that we are working around. What I would encourage the task force to do is to just have a conversation about priorities, like what's one or two things that you care most about, and that's what you're going to talk to legislators about. And happy to help with that conversation, like the whole way through. Um, but I think that's like something that each organization is doing for itself. Some groups like Blood Cancer United, which used to be Leukemia Lymphoma Society, is really working on medical debt and trying to make medical debt less onerous. Um, and they've got some bills this year on medical debt. So if that's something you want to work on, that's an area there. There's the subsidies that I mentioned. There's the Apple Health changes is something else. So it's really kind of depends on how different communities are impacted by these changes in terms of what they're doing. Kind of a long answer, but does that help you, Foxy?
Yeah, for sure.
Okay.
Yeah.
Hi, Jim. Thanks for being here and uh, helping us with this. I'd like to go back to the first thing, which was lawfully present immigrant
Mhm.
coverage,
Yeah.
and really kind of talk through that. One, what does lawfully mean? So that we can really say, okay, this is the requirement, and then here are the next steps.
Yeah, great question. And I am not as up to speed on the immigrant issue as much as I probably should be. There's other coalitions that we work closely with that have kind of tackled this. I'm gonna look at something though while we chat to get you
Mhm.
some better um, sense of kind of what that what does that mean, right? Lawfully present. That's a pretty darn big umbrella. Um, Northwest Health Law Advocates is an organization. I'm going to put it here in the chat, and they have this hub of all the changes that I just talked about. I actually kind of relied on them for my slides. And we can go through this, and they put a training together this summer for kind of attorneys and social workers. And oh, so there's even one here on immigrant health. Let's see. That I'll put in the chat as well. So, as just examples, these are the people that will be able to keep or get coverage. U.S. citizens, including naturalized citizens, green card holders, individuals with Cuban Haitian entrant status, Compact of Free Association migrants, COFA. I don't know much about that. But let's dive into this. Ken, I'm gonna keep sharing stuff in the chat and get you what you're looking for. Because that probably still doesn't answer your question, does it?
Yeah, well, we have immigrants from uh, Somali immigrants, Kenya, and some of them have recently been put on the bad list, so to speak. And I just want to make sure that we could try to clarify some of these things here.
Yeah, for sure. So
And then the
yeah.
other question I have is there infrastructure for these things? I mean, there are all these changes, there are these requirements, but I haven't seen a whole lot of uh, of stuff that says, okay, this is what you do. Step by step, these are the things that you can do to get coverage if you don't have coverage, those type of things. Is that infrastructure in place, or is it going to be in place you got to say, by January 1st? You would think that would be in place, but I'm not sure.
Yeah, I wish I had a better answer for you. I would say some of this stuff is it's just this everything's in flux that, you know, I'm pretty sure, well, there definitely won't be subsidies in place January 1, right? Like that's a fact. A lot of these other changes don't, as I shared, don't take place till 2027, 2028. And we don't yet know the fine print to actually be able to share with people. The sad part too is that the the most important thing there is like what can you do about it, right? Because like the law is passed, but then okay, that was your source of insurance. Where the heck do you go next? We don't know that piece, and that's what legislators are trying to stand up this session is some sort of alternative program for people that are getting booted off their federal coverage. So again, like not a good answer. It's not what you're looking for. But I think we could, and I'm happy to help facilitate like a conversation with NOLA, this organization that I referenced here, because they might have or know a little bit more about kind of some specific fact sheets that you could share within your community.
Oh, that's helpful. That would be helpful if we could at least work together, and then we can talk to people on our side and see what issues they will run into or have run into,
Mhm.
because that's got to be a cause and effect thing, it sounds like to
Mhm.
me.
Yeah, yeah. And I think the subsidies are what have hit people so far, right? Because people started shopping, I think like November 1st. I mean, I get my healthcare through Obamacare. And so that's where people know right there, like that's one thing.
Mm.
Um, but this, my cousin's on Apple Health. I saw her last night. I was asking her, like, have you heard about all this other stuff? And she's like, what? No, like this stuff, this is happening. And I was like, oh, geez, like, of course not. Of course you don't know. Like, so I hear you. I don't have a good answer.
I
Oh,
mean,
well,
even with the subsidies, ours is going to change. I haven't done mine. I have to do it. You just reminded me that I need to go on there and finish it out but I'm avoiding it, to be honest with you. Um, but there wasn't anything that came that said anything about it. You just kept hearing it in the news, and I think part of you is kind of like, surely this is not going to really happen because it's not like it's cheap as a family anyway. Um, so I think we were just hoping it would go away, and it's not. But I think that's the same with the Apple Care. It doesn't feel like there's a lot of information getting out there to prepare for these things. It's just kind of here
no,
we are with
because
new changes.
yeah, because in my humble opinion, this is very arbitrary. They've decided to do this, and they have no way to, one, convey it properly, two, uh, have a process for what happens after this is done. And it's frustrating to us, Americans who are living this. It's like, well, you guys are over here, you're not affected by this, so you don't really care about this. That's what my impression is, anyway.
I think you're right. But I think right now that's what's happening a lot of places. It's so unfortunate, but yeah, things are getting cut. We don't hear about them. All of a sudden, people are going to the pharmacy to pick up their medication. It's hundreds of dollars when it used to be $20. So there's so many things happening within this, and it doesn't get communicated. I mean, and so people are in shock, and like you said, Foxy, it's just so unreal. We kind of hope it'll just go away, because you're like, how can this be happening? But it is happening, and I don't know. We might be adopting a whole bunch of people.
Yeah, I mean, one thing for
It's so ironic because school and we're just pushing people that way. More people
You're
would
breaking up there, Peggy. Sorry.
be out there selling bills, and
I muted her to see. Peggy, now unmute and see if it works. She's frozen. At least she's frozen with the smile.
Yeah, no. What?
There you are.
There, you're back.
I thought you guys kicked me off with my radical self.
No, no, it froze.
Yeah, no, we were editing you actually.
Bleeping me out. Don't bleep me.
Now
All right.
you're better though.
Okay.
I mean, Fox, one idea is to use your social media platforms to encourage people to share their stories to help connect
Yeah.
people with these resources. That, as Ken pointed out, like we don't have the resources yet to connect people to, but we can work on that, because I think
That's a good
it
point.
people can help to start make the connections between when the premiums are going up literally because the Republicans made a decision not to renew them. Like that's just like that yes, there's other reasons, but that's a very large reason there. And people may not know that, right? And so um I think social media is going to have to be part of this kind of storytelling and education effort.
But Jim, is there, just so that I can, because we can easily go down, and this is the reason. Um, what is the reasoning behind doing, just like if we take subsidies, is it because there's a deficit and we're trying to find ways to cut this budget? Is this the reason? And then when you just said, there might be other reasons why the subsidy went up beyond that the Republicans voted this way. What is that other thing? Can we pinpoint that, or are we just trying to not say it's only this Republicans, to not be political?
Yeah, no, I think no, be political. I would say one, like you don't need that. Like especially at the state level, even the Republicans here, for the most part, asked the Republicans in Congress, like, don't cut Medicaid. Like, there were dozens of Republican legislators that asked that. I mean, I saw that letter that said, like, do not cut this. So there are much more reasonable Republicans in Olympia, I think, than what you have in DC. There is this whole other piece about like how do we make the healthcare system more affordable. This is a larger effort called the Fair Health Prices Coalition that the Patient Coalition, actually helped start a couple of years ago to look at consolidation. When all these healthcare systems just get bigger and bigger and bigger, they get more expensive. They don't get better. They just get more expensive. Like literally, like there's just all this evidence that points towards that. So that's kind of one issue, this consolidation and these mergers and acquisitions. We are actively working on that separately. I don't think, again, when I talk about like setting priorities, I don't think it's maybe good for you guys to be aware of that, but I don't think it's like your highest priority right now. The most important priority is like get people coverage, and then we can work on the larger systemic reforms that absolutely need to happen. But a small organization like yours, I think, is most effective when you like are really targeted in terms of what you want legislators to do. So, and this, like the subsidies, again, the state level subsidies, I keep talking about that because that's where the patient voice has been really effective. And, the legislature allocated, I think like 70, maybe $100 million last year to those state subsidies, recognizing that we need to make insurance more affordable for people. So.
Yeah, and as much as I'd love to take on the insurance companies, that is not not going to happen with our organization.
With your what?
With our organization, we are not big enough or have enough power to talk about how the is really dictating medicine and how it's being distributed and who does what and when and how much it costs.
Yeah. And what you're saying there, Ken, I love that you said that because that's actually there's a number of bills that go after that whole kind of concept that we're looking at this year as the Patient Coalition. So one of them requires insurance companies to be more efficient. Another would kind of streamline the prior authorization process. Um, Another one aims to reduce the corporate influence on medicine, and that's actually geared more towards providers than health insurers. But we've seen Optum come over, right? This one of the 10 biggest companies in the world come
Mm.
over and take over the Poly Clinic and the Everett Clinic. And when Wall Street is controlling your health care, I mean, you know who they report to, right? And it's not to the patient. That's just the way it is.
Right. Stockholders are everything, right?
Hmm.
Right.
And
Mm.
then of course there's the how do you dispute something that you are once you're cut off.
Hmm. Hmm. Yep. So yeah, each of those things. I mean, like there was a bill we passed a couple years ago, actually, like governing that dispute process and making it really clear how patients can appeal and the denials and that there's third party systems in place to appeal those decisions. But yeah, another body of policy.
Well, Jim, this has been very helpful and enlightening for me.
Hmm.
And it has really, I appreciate what you said that we need to really get our priorities in order so that we can really be targeted and focused.
Yeah. In some of that, in talking with legislators, that could just be a first step is to request some meetings with a few folks to help with that process because they can tell you a little bit more of kind of like, hey, this is what we're working on this session. Here's where you could plug in. So, kind of consider that as you're doing this, knowing that the legislative session starts January 12th. That's really fast. But I think legislators are also understanding of the fact that like this stuff's moving so fast. You may not come in with like a smooth and polished something, but the fact that you're there, you're showing them that like, hey, this is our community, this is how we're impacted. That can still be very beneficial and contribute to the conversation. Even, I mean, just as a simple thing, for them to have stories to share with other legislators. They
Mm.
they they love those. They do not have enough people sharing stories of our terrible healthcare system. Like they just don't. I talk to them all the time and they're like, no, I want stories. Give me stories. Give me stories. So that's a great starting place is to just have people share their stories.
Yeah.
And those stories would be about would be about a terrible experience or a terrible something rather than a personal story.
Yeah, I mean it's kind of a short personal story, like, how important is Apple Health to your life, right?
Okay.
Right? I mean
Right.
that's what
Right.
happens when you can't buy insurance because your premiums went up.
Right.
That's your, that's the story. That's
Okay.
everybody has that, right? What would you do without insurance? I can tell you right now. I mean, my daughter's got asthma. How would I get to see a doctor if I don't have insurance? There's
Right.
very few primary care doctors out there right now. If I don't have insurance, what's it going to cost me to get that inhaler every month? Like, that's a story.
Okay.
So
Thank you.
don't overthink it. Yeah.
Okay.
Well, what I've just realized is I don't, I had a primary care physician, but she is not in a lot of the plans. I mean, she's only in one plan. And that plan does not, since I have sickle cell, I have to have a hematologist. And because of that, they are not on the same plan. So what do I do with that?
Wow. Yeah.
That's when we would capture your story, is what Jim would be saying, is that this is
Right.
so we can show the complications of
Hmm. What do you
some.
do? I was thinking, what do you do?
Right.
No,
Well,
What do
literally,
you
No,
do?
what do you
Is that
do?
a
what I want to
what do
know.
you do? Yeah.
so what I've done is that I'm searching for another PCP.
Yeah.
And it's like, well, that really isn't fair because you establish a relationship with a PCP. I mean, I think that people think that you can plug and play these docs, and it's like, no, no. There's some that you can communicate with. There's some that you can't. There's some that don't have our interest in what you as a person may have, like sickle cell. It's like some PCPs are like, you know what? Too complicated. Don't want to deal with it. Go find someone else.
Yeah. Yeah. That's so did that just happen with recently with you? Has that always been the case, or is this with this
No,
new
no,
plan that you're
this
looking?
is recently because
This is the new plan you're looking at?
yes,
Okay.
because well, I had to do something because the deadline was December 9th. So
Okay.
yeah, because I recently retired and I'm at that age where it's like, okay, I need to select a plan. And so I had to go through that. And that's where I came across this complication.
And we do have others that have dual, they have more than one insurance because they have some can't cover the others. There's who that has two genetic disorders, and one there he has to go to do to two different places and have two different insurances. So we have to pay attention to that. That
Hmm.
like sounds like we should really pay attention to that.
Oh, absolutely.
So yeah, okay.
Anyway, just tip of the
Wow,
iceberg.
it's a lot. It's a lot.
Yeah.
Mm.
And one thing there I mean, I'm guessing you're talking about Medicare
Yes.
with that open enrollment there, right? As I talked about, right, that's a federal thing, so that's a little bit less relevant to state legislators.
Hmm.
But your story is exactly the same people, the exact same thing of people on Apple Health, right? I mean, this was my cousin last night. She's like, I got this therapist that I love. They're not in my network. And she's like, I'm gonna have to change therapists. And she's like, I've worked with this woman for 4 years. Like, I need her. So, right, like that story, it's very easy to just keep that kind of front and center for state legislators to shift it into, and here's, what's in your kind of wheelhouse.
Mm.
Well, Jim, this has been really, really helpful. I feel like,
Mm.
we're coming away with knowing some of the things that are coming, having some sense. We'll be having a board meeting in January. So I think this would be helpful to come back to about what we want to do for 2026, 2027 in regards to going to visit our legislators, just making sure we have a presence. But yeah, I just appreciate you coming.
Yeah.
And I heard you say, you're willing to help us as we think through those
Mhm.
things.
Yeah, yeah.
So thank you for that.
Hmm.
Yeah, it's just a great session. Very
Yeah,
Yeah.
thank
informative.
you. Yep.
Yeah, thanks.
Yeah, happy to. I
Yeah.
will get you a few documents, and I shared those in the chat
Hmm.
Okay.
about NOLA, if that's something. Again, and NOLA, they're another organization where they don't do kind of individual advocacy, but they do have this hub that is a great way, and they're trying to develop what Ken's talking about in terms of these resources that share with people on a very high level in terms of what's changing. And so, if that's something that you're interested in, I'm happy to do that. And we could talk a little bit more about what exactly you'd want kind of out of that, but they're very available for a conversation. So
Awesome.
Great.
Awesome.
Yeah, very good. Yeah.
Yeah,
All
thanks,
right.
Jim.
thank you.
Thanks.
Thank you
I
so
appreciate the chance
much.
to chat and look
Yeah,
forward to more discussions.
For sure.
sure.
All right, friends. Well, this is again our last kind of Ruha for 2025. I hope you have had a wonderful year. It has been a joy to kind of hang together over the year. We will have January 10th is our New Year's celebration over at Odessa Brown, the Othello Clinic. So love to have anyone out. Should be a good time over there. And then mark your calendars. January 17th is the next education series. We do have. We're going to have sickle cell in the bones, a conversation with a provider, a researcher who's been doing that work. We have Tegan coming back to talk about exercise and sickle cell. They're having their second part of their research coming out and are looking for new folks to get involved with exercising. I think it's for ages 40 and up who have sickle cell they're looking for. And then we do have what's her name? Lenny is coming. She does the trans Doppler procedure and is going to talk about the importance of that procedure and why and what it does to help with preventing strokes. So I'm really excited to have the three of them coming in our next education series. And again, Jim, thanks so much for today. Happy New Year, happy holidays to everyone. We'll be seeing you.
All right.
All
Happy
right.
holidays to all. Yes.
Yes.
All right. Bye-bye.
Bye.